We're excited to introduce Dr. Godfrey Philipo for this special episode for the Oxford Global Surgery Conference. Godfrey has bridged the gap between being a medical doctor and a public health specialist as a clinical research coordinator for two main projects, looking at improving cancer care in Tanzania and addressing children's surgery in Tanzania. He's also previously served as a co-founder of Incision and was on the board of trustees for this organization. We're excited to welcome Godfrey to the show.
Thank you, Rihanna and Taylor, for hosting me.
Thank you, Godfrey. Now, for our first question, having a strong clinical research capacity in LMICs is crucial for global surgery. How did you decide to go from being a clinician to being a full-time public health researcher?
Okay, thank you, Rihanna, for that question. So, for me, I feel like the route was not a bit direct. So maybe the bigger impact was from my medical school, where I joined the group of medical students. And then when I went for my master's in China to do the master's in public health, that created a more understanding of the global burden of diseases, but specifically merging with the global burden of surgical diseases. So through mentorship, through my peers, that gave me the understanding of global surgery. But then my understanding in public health and medicine gave me that opportunity to be able to understand the two. But then the nature of the work that I got after graduating, that was having a bigger impact. So I got employed in research, and I was definitely working on on cancer research. That gave me more time to think about myself, but then to see more how I can contribute, even if I'm not a surgeon or if I'm not a clinician. So I can contribute in research in producing good evidence that can help people to do better in cancer care, but also in this new burden, the global burden of surgical diseases.
I think that's so great. I love that we're talking about this and the impact that different people can bring to global surgery. We've talked about this before, but it really does take an army of researchers, of people building hospitals, funding them, technicians to run the machines. We're all a big team to run this, and so it really takes a lot of time and effort and people with different skills to do that. So we really appreciate all that you're doing with the research. And one thing that we do want to talk about with your research is obviously COVID-19 has changed the face of really global surgery in the world around us. And so how has COVID-19 really affected your research, both in the positive and in the negative manner?
Okay, so I can start with the negative because that is the bigger part of it. So
Sure.
for me, who is working in research, we had to stop a number of research projects so that we can allow a room for clinicians to work with who work with patients to have and also to reduce the exposure of so for the researchers who really doesn't take care of patients. But then a number of research that I'm working on, and maybe a number of schools, the number of projects that are being involved require training. So COVID-19 and most of the training are done by a collaborative team through these partnerships. So people couldn't travel to come or go to receive other training from other countries or from other people, but also the number of patients, especially those with elective cases, had to pile up. There was a big backlog for patients because mostly, since the number of clinicians it's minimal. It's the workforce is not that much in Tanzania. So, and then the most were much involved in COVID. So even the number of cases were reduced. So even no patient didn't have enough access to surgical care, I can say. So those are the few, but I think the other, maybe the impact in clinicians themselves. It's a new disease which created a bigger panic among people. So it brought a number of negative impacts. In the positive impact, very few, but I think we got an idea to reinvent ourselves, to think of other ways to, for example, to handle training, going from on-site to online training, also trying to find a way where we can communicate, we can make sure all the things that we are working on are moving through the online using technology. So we got to think, I can say, to try to make sure that life goes on as usual. Although it is not usual, but I think at least we get to adapt to a new way of living.
Absolutely. And I think that's probably one thing that we can take from this whole period of the new normal, which is how to connect in a different, more virtual way. And this probably leads into our next question, which is just about the interaction between high-income country research centres and LMIC research centres. Obviously, this whole wave of online technology being used in research and teaching must have impacted research, but also how can we use these sort of technologies to go against this paradigm of HIC researchers being accused of extracting data from LMIC centres without necessarily adding value to their LMIC colleagues?
So my thinking is that most of the partnership are being formed, and people who form the partnership know each other. They know what they want to do, and coming up with ideas, coming up with research projects, it's a mutual understanding. But this one has a bigger impact in trying to make things in line, trying to make sure that everybody, and whether it's high income or low income, everybody benefits from that research. And also, the most important, I think, the patients benefit out of it. And I can say another thing, maybe the institution themselves and the government, the review process in a number of countries, that has a bigger room and a bigger impact in trying to make sure that everything goes on ethically, but then trying to have a balance that this kind of research is of importance in this country or this one is not. So the oversight of the government and the institution is really important. But then the people themselves, I think they take a bigger part in trying to understand what they want and what impact they want to bring, and that has to come up in a mutual discussion and mutual understanding among the people who are involved in the partnership.
Thank you. I think those are some really good points and things that we need to be thinking about, especially when we're working with governments as well. So just in our last couple of minutes, could you just tell us maybe one thing that you would tell LMIC researchers when they're trying to set up their own initiatives, something that they should be aware of?
I can say one thing is to try to understand that it's not easy. We need to learn every day. We need to learn about the content of the research that you want to do. You need to learn the interpersonal communication among people, because most of the research are being done and funded when you have a collaboration. And then they have to be ready to learn and learn and learn without stopping. But the most important thing is to find a mentor. It doesn't mean that a mentor has to be someone with a bigger understanding, a bigger knowledge of the subject, but even the peer people meet and talk and try to discuss. You can learn something out of that and be able to establish a research.
Thank you so much, Godfrey. I think that's great advice, to try and find like-minded people and learn from them. And I think that mentor doesn't necessarily need to be senior, like you said, but just someone that is able to inspire you and guide you and just give you that advice. And certainly, I'm sure it's a two-way street with people bouncing ideas off of each other. So we appreciate you speaking to us today about your experiences with COVID-19 and research, and just about global surgery research generally with what you've been doing. So thank you very much.
Thank you, Rihanna and Taylor. Thank you for having me.